Let's talk about that nagging pain in your low back, your buttock, or your groin. It can be a really tricky case to solve, but today we're going to turn you into a pain detective. Let's get right into it.
You know, this kind of pain is like a master of disguise. It can send you down a total rabbit hole, maybe treating your hip when it's really your back or the other way around. But don't worry, in the next few minutes, we're going to give you a super simple screen to help you find the real pattern. So to solve this thing, we've got to become pain detectives. And you know the first rule of any investigation, right? You have to map the evidence. So for a second, forget about trying to describe the pain. Let's just figure out exactly where it lives. What's really interesting here is that we get so caught up in words like sharp, or dull, or achy. But your nervous system, it's not a poet, it's a cartographer. It's a map maker. It knows the exact territory of your symptoms. So let's ask it for the map instead of a poem. Okay, so this location is, without a doubt, your most important piece of evidence. If the pain is mostly in your groin, that often points right to the hip joint itself. Buttock pain? Well, that's a bit more of a toss-up. But, and this is a big one, if your symptoms travel down below your knee or you get that numbness or tingling, that is a huge clue that we're likely looking at a nerve pattern coming from the spine. All right, map in hand, it's time for the interrogation. We're going to gently question your body with 4 simple moves. Now, the goal here isn't to get a diagnosis, not at all. We just want to see which of our 2 main suspects, the spine or the hip, is easier to provoke.
Okay, first up, we're testing the spine with what's called the seated slump. Just follow these steps nice and easy. Now, the key thing you're looking for is this on-off switch behavior. If you feel those familiar symptoms kick on as you straighten your leg, and then poof, they ease right off when you lift your head. That's a really big clue that points toward nerve sensitivity.
Next up, the straight leg raise. Lying on your back, just slowly lift that leg. And remember, this is not a hamstring stretch competition. We are listening for one thing and one thing only. Does this movement bring on your specific, familiar symptoms, especially any of that stuff that travels down below the knee? All right, let's switch suspects. It's time to question the hip. For this one, you'll sit down, keep your knee pointing straight ahead, and just rotate your lower leg outward. This move really zeroes in on the internal rotation of the hip joint. The big giveaway here? Pain deep in that groin pocket, or if you notice it's way stiffer than the other side. And our final test is the Faber. You probably know it as the figure 4 position. Now, where you feel the discomfort here is everything. If it's deep in the groin, that's another vote for the hip joint. But if the pain is more around the back and the pelvis, well, that could be the SI joint, which is a whole other common character in these cases. Every clue matters. Okay, detective, the interrogation is complete. You've gathered your evidence from the pain map and those 4 moves. So now it's time to analyze these clues and see which suspect profile they're starting to build. Think of this as your little evidence calculator. Just run through these questions for yourself. Do you get that below-the-knee pain or tingling? Yes or no? Is the pain worse with things that rotate your hip, like tying your shoes? Is it aggravated by sitting for a while or even coughing? As you answer, you're going to start to see a pretty clear pattern emerge. And here it is, side by side. These are the 2 main profiles. On the left, you've got your spine or nerve pattern. That's the one with symptoms traveling down the leg, and it hates sitting. On the right, you've got the classic hip joint pattern. Pain is mostly in the groin, and it really doesn't like rotational stuff, like getting in and out of a car. Which one of those sounds more like your story? Okay, before we go another step, we have to talk about something really important. Because while being your own pain detective is awesome, you absolutely have to know when to stop screening and call in the professionals right away.
This slide is non-negotiable. This is a full stop. If you are experiencing any of these red flags, things like a fever with your pain, new and significant weakness, numbness in that saddle area, or any changes in bowel or bladder control, please stop this process and seek urgent medical care. Your safety is priority number 1.
Okay, with that critical safety check out of the way, let's get back to our case. It's time to talk about the red herrings. These are the really common mistakes that can lead even the best detectives completely astray.
First up, chasing that MRI too early. An MRI can feel like the ultimate clue, the smoking gun, right? But here's the thing, it can also be a total illusionist. Studies on people with 0 pain show that MRIs often find stuff like disc bulges. These can just be like wrinkles on your skin, a normal part of aging, not necessarily the scene of the crime. I love this quote because it absolutely nails it. Sometimes the fear and anxiety that come from reading an MRI report can be way more disabling than the physical thing itself.
So here's the bottom line. You have to match the image to your clinical pattern. Don't let a piece of paper tell a story that your body doesn't actually support.
And the second red herring is stretching whatever feels tight. I mean, it feels productive, doesn't it? But if your pattern is pointing towards an irritated nerve, aggressive stretching, well, that can be like throwing gasoline on a fire. You're just tugging on an already angry electrical wire, and it can make things a whole lot worse.
So, you've gathered your clues, you've avoided the traps. What's your next move? This is where all your hard detective work really pays off, by helping you get care that's actually targeted and effective.
Let's put it all together into a super simple flow. This is your don't waste your appointment plan. First, you have your map. Second, you know which of the 4 tests brought on your symptoms. And third, you've confirmed you have no red flags. This little bit of prep work can completely transform a confusing doctor's visit into a super productive one.
And this is what you bring to that appointment. This is your case file. You're no longer walking in saying, my hip hurts sometimes. Nope. You are showing up with data. A pain map, your test results, a list of your biggest triggers and what makes it feel better. This is how you team up with your clinician to solve the case fast. Your pain has a pattern. It is not a mystery anymore. You now have a case file that is full of clues, and you're ready to stop guessing and start having a productive conversation with a professional. The case isn't closed yet, but you're no longer just the victim here. You're the lead detective. So are you ready to solve it?